Ahora me gustaría invitar a Yuko Snow, para presentar. Entonces, Yuko, well, thank you very much. Thank you for attending our call, our meeting here. It's really important to have you here to show us, the news about Recon. And I know that this is just the beginning, right, Yuko? So please, the floor is yours.
Hi, nice to meet you. My name is Yuko Snow, Global Product Marketing Director of Recon. I hope you can see my screen. Yes?
Yes.
Okay. So I'm so excited to show you about Recon today. Recon is the only solution which provides true deep learning-based denoising and deringing by leveraging raw data in a single model as of today. So therefore, it can provide a sharper, clearer, beautiful MR images without sacrificing scan time, or even faster. So let's take a look at the technology behind and how it works together. In conventional way, when you try to scan faster, we need to undersample data. In that case, because we don't have enough raw data, image quality is degraded. To make it up, we apply DICOM filter after MR images are reconstructed. But those image filter is not perfect. That's why image getting blurry and some artifacts are still remained on the images. Recon approach is totally different. Deep learning-based technology is integrated into reconstruction pipeline and leveraging MR raw data, not reconstructed DICOM images, to challenge this problem. MR raw data is like a giant Sudoku grid. I think many of you knows about Sudoku puzzle. There are a bunch of signals are stored as a number. It really looks like a giant Sudoku grid. Same as actual Sudoku grid. Some cell does not have a number because we undersample data. And some cells have a wrong data number because data are affected by noise. But Recon fills in and correct those raw data by deep learning neural network, which was vastly trained by huge number of cases. Therefore, it can deliver sharper, clearer, beautiful MR images in much shorter scan time because less raw data is needed. This is actual phantom data compared with between conventional reconstruction and the Recon images. You can see much sharper and clearer image structure visualization without ringing artifact on Recon images. Therefore, Recon has so many potential. Let's look at another example, the resolution and the SNR comparison. The left knee image has 0.6 spatial resolution with 3 millimeter slice thickness. If you would like to improve resolution in the same scan time, in this example, 0.4 spatial resolution and same slice thickness 3 millimeter in the middle, image get noisier because we just sample less signal in each raw data cell. But Recon DL boosts up SNR because it can significantly reduce noise. So the right image by Recon DL, it has a higher resolution, but you can see higher SNR even compared with lower resolution images. This is a maximized view of the joint. You can see clearer joint visualization on Recon DL images. This is another example, comparison between comparison and SNR and the shorter acquisition time. Left image was acquired in 3.5 minutes with the 2 necks. When we scan it with the 1 necks, reduced necks, scan time get faster, but because we acquire less signal, image getting noisier. But again, Recon DL boosts up reduce noise. That's why SNR is getting higher, better, even double more scan time images. That's the reason why Recon DL has a lot of potential. Those examples, you can utilize Recon DL in various ways. You can improve image quality or scan time or even both. These are scan time reduction data from our evaluation site. University hospital tended to seek higher resolution and image quality. So they tended to use Recon DL to improve resolution image quality, but still they enjoy about 30% scan time reduction. Outpatient imaging center would like to scan more patients. That's the reason why they use Recon DL to reduce scan time. In this example, you can see this customer improves scan time about half, but still they enjoy some amount of SNR improvement in addition to scan time reduction. When we sell Recon DL, when we started to sell Recon DL, many customers are concerning about the AI technology, which may take out some important clinical information or adding something artificially. But as you see in this clinical case, fuzzy structure is clearly visualized without noise by Recon DL. Then nothing disappeared and nothing added. We now receive many positive and convincing customer comment that Recon DL did not taking out any important information, not adding anything artificially with those examples. Some customer considering, the Recon DL images is too smooth, and it is not it is uncomfortable to read too noiseless images. Therefore, we prepared 3 different noise reduction level: high, medium, and low. Some customers start using from low and medium. But based on our research, 90% of the customer ended up selecting high setting. Then, we know customer needs some time to get used to noise-free images. But we have a 3 setting, so you can start whatever you want. But I'm sure, you're gonna get comfortable reading high noise-free images. Now we already have received about 1,000 Recon DL orders, and we already delivered about 400 licenses globally. And we estimated about 1 million patients were already scanned with the Recon gel as of now. Customer feedback are super positive, and we also have a lot of peer-reviewed publication. This is a list of the 10 publications that we worked with academic collaborators around the world to show Recon gel in clinical practice. Two things I would like to point out about this list. The first, the variation of the clinical area covered by those clinical publications. It shows that Recon gel works across all anatomies and not limited to one or another anatomies. It can be worked clinically across the range. And second, we had 6 publications in the last 2 months long. This shows that publication pace is accelerating and catching up now about 2 years after releasing Recon gel. We are expecting that more exciting results will be published constantly. Let's take a closer look at one of the latest publications. This excellent publication in Nature Scientific Report from just last month shows Recon gel applied 2D thin slice pituitary tumors. On the left image, on the far right image is 1 millimeter slice thickness image compared to conventional 3 millimeter slice one in the middle. The Recon gel 1 millimeter image shows improved diagnostic detectionability of those pituitary region. The thin slice images are normally noisy, but with the combination of Recon gel now improves diagnostic performance. This is a clinical game changer, and the publication data support it. Another beauty of Recon gel is, the coverage and the range of the compatibility. You might think that technology as advanced as Recon gel is only available for certain customers or systems, but we don't want anyone to miss out. Recon gel is now available to almost all GE MR scanners, including our old install base. It's going to be enabled by simple upgrade. And it does not have any anatomical limitation, as I showed you, and no coil limitation. So you can scan any anatomy with any coils with the Recon gel across the range from 1.5T, 3T, and even 7 Tesla scanner. That's the reason why we have lots of positive customer feedback across the world. And we created a documentary film, Unmissable, in this summer. If you are still suspicious about Recon gel, please watch our documentary program. You may be encouraged by various doctors' enthusiastic feedback across the world. And now, Recon gel is compatible with 2D and diffusion sequences, which can cover 70% of clinical scans. But this is just the beginning. We just submitted 3D and motion correction sequence enhancement to FDA a few weeks ago. They are still 510(k) pending, but not available for sale, but which are designed to dramatically improve clinical coverage. I assume 90%. I would like to show you a couple of examples. Throat area tended to be affected by swallowing motion during a scan. So customer prefer to use motion collection technique, propeller. Recon propeller are designed to help customer to achieve high spatial resolution imaging with lower scan time. You can see clear central canal visualization without motion in the Recon. Both image apply propeller, so you don't see patient motion on both images, but you can see drastic SNR improvement. Another example is about shoulder and the pelvis. Those are another challenging anatomy because of patient motion. Shoulder is always affected by breathing motion, but Recon would enable us to avoid repeat scan. Pelvis area affected by two types of motion, breathing and digestive motion. Potentially, it can reduce the need for antispasmodic drug to reduce motion artifacts. Reducing those drugs is better for patient. At the same time, it could help improving your facility workflow because you don't need to inject drug. These are 3D cases. Benefit of 3D imaging is enabling you to see image from various angles. You can see great SNR improvement on Recon images, and also even reformat images has a dramatical SNR improvement, even compared with direct sagittal scan with conventional reconstruction. Then last example is a multi-phase 3D dynamic sequence in liver. The new enhancement enable multi-phase dynamic sequence in 3D in liver and breast. We have a lava for abdominal area and vibrant for breast area. Those going to be compatible with Recon. As you see, as you can see, image gets sharper and clearer, and ringing artifacts are correctly removed. We believe Recon is one of the most exciting revolution in MR history. Please enjoy the rest of the session and learn more about Recon from our users. And thank you very much for your time.
Cool. Thank you very much. Thank you for your presentation. We have one question from the audience. The question is if Recon is a kind of filter. So if you can explain that.
Answer is no. As I showed you in the earlier slide, Recon is integrated into reconstruction pipeline. Then we are approached to raw data, not the DICOM images, to clean the raw data and reconstruct image without noise and artifact. So it's not a filter. That's the reason why many customers enjoy not only image quality improvement and as well as a scan time reduction. If it's a filter, we cannot reduce scan time.
Okay. Well, Yuko, again, thank you very much for your presentation. This is the only question that we have right now. But so we have many participants in the room. Feel free to ask. We will answer after. Okay, no problem at all. So you can continue asking Yuko for any question about Recon. Okay, Yuko, thank you very much.